Welcome back, episode 3. We started off with the thyroid last week and we were going through a long list of symptoms that you can experience if your thyroid is not working properly. So let's dive right in and continue our long list of symptoms. We left it off with coldness in your body and that you probably are the person who wears more clothes than anyone else to keep warm. The next one would be metabolism. As we know, the thyroid is the master regulator of your metabolism. If it slows things down, there's a lot of things that comes back sort of at the back end of this slowdown of the metabolism. So you could, for example, experience a high or rising level of cholesterol. We see this very often. And because things slow down, the removal of fatty acids also slows down, which causes the cholesterol to rise or stay elevated. Low body temperature is indicated with the coldness. The low body temperature would make you feel more uncomfortable in your body, and also if your body temperature is lowered, you are more prone to infection and viruses and bacteria manifesting in your body. And you might have noticed that you sweat less than other people. If you're running or you're in the gym, it's really hard for you to work up a sweat. It's not coming as easily. Also, if you're a sauna person and you sit in the sauna, everyone's sweating around you and you just have a slight wet film on your skin, that's also an indication that maybe your thyroid is not working optimally. And as we all know, that's probably the number one thing we know about the thyroid. We have a tendency for weight gain due to a slowed down metabolism. It's much easier for people with thyroid conditions that are not managed correctly. And let me emphasize this. It's not a given. It's just if things are not managed correctly, we have a tendency to gain weight, and it's much harder for us to lose it as well. We can have symptoms on the thyroid even itself. So we can have a swollen gland that we feel when we touch it, it's swollen, it's uncomfortable. It might even push on our trachea a little bit at times, so it causes us this feeling of having a knot here in our throat. Some people are diagnosed with a goiter. There can be pain when we want to swallow if the thyroid gland is swollen. And if we talk a long time, or we have to talk louder for a long time, we often get a hoarse voice, and it's really difficult to get our voice back in a good time frame. So if that's something you experience, that you lose your voice often, you might want to go get your thyroid checked. Moving into stomach and digestion. This is very tightly linked to hormonal health and thyroid health as well. A lot of people I see in my practice have what's called acid reflux or GERD, and they are having often low stomach acid due to this acid reflux. And also a long history of taking antacids to lower stomach acid because they were told that they were having too much stomach acid and hence they had the pain, which is actually absolutely the opposite for most people. They already start out with low stomach acid and then they depress them even further, which will bring symptoms on of acid reflux and indigestion in the stomach as well, as the food sits there and ferments. And then you feel bloated and you feel if your food is indigested and you're just not feeling very well after eating, right? You often use this expression, it doesn't sit well with me. You also tend to have more sweet cravings usually. So if you can, you would grab the sweet stuff, or you have your little stash. We're much more prone to having sweet cravings. Our blood sugar is more usually more imbalanced than people who do not have thyroid issue. So this is also an indication that you might want to pay attention to. Because you're eating and you're having this bloating and this indigestion, oftentimes we form a poor appetite or no appetite, and we tend to skip meals just to escape the uncomfortness, which is also not a very good strategy. From eating too many wrong foods like sweets, for example, and not having a stomach that's working properly. There are also a lot of people with thyroid issues who develop conditions like SIBO or SIBO, it's small intestinal bacterial overgrowth, which also causes an imbalance in your gut, which needs to be looked at so that you feel better. So what else happens if your digestion is not working properly? You will get issues with your nutrients. So not only do we have a deficiency in nutrients if we don't eat the right foods, we also can have nutrient deficiencies if our absorption is impaired. And for example, if we're not having enough stomach acid, we run into trouble of absorbing our nutrients properly. And some of the main ones would be iron, B12, vitamin D, but basically all B vitamins could be at risk. So this is something that also a lot of doctors test alongside the thyroid to see if there are any nutrient absorptions problems. So zinc and selenium would be another one. We need those building blocks for forming thyroid hormones properly. So if we're low on selenium or zinc, then we also might exacerbate our thyroid problem. Iodine is still a very controversial topic, but as far as I'm concerned, iodine needs to be monitored very, very closely because excess iodine is not good for your thyroid, and neither is too little iodine. So there's a very narrow range, and it's good that we test it along heavy metals as well, but we go into this some other time. Cardiovascular disease, moving along here. Heart disease. Heart disease can be consequence of undetected thyroid conditions and imbalanced thyroid conditions for a long time. So the heart can be directly affected. The blood pressure can rise, cholesterol can rise. Also, people sometimes with too much thyroid hormones experience heart palpitations, which is also very uncomfortable. So if you are suspecting that there are some issues, please also ask your doctor to check for your thyroid. Elimination. Elimination is also something that we see quite often. Constipation is more common than diarrhea for people with thyroid problems. Hard stools, only going to the washroom once a week, things like this, which is of course not good. Those are all signs that you might want to get your thyroid checked. And as I mentioned earlier, things like candida or bacterial overgrowth are often a cause as well that we would have to look at a little bit more closely. But also things like IBS or colitis is often accompanied with people having thyroid conditions. So if you have any of those conditions, you might want to ask your doctor for a thyroid test. Hair and skin is another very good indicator that something might be off. If you have no eyebrows or you feel like the third outer part of your thyroid is thinning, or you lose your hair there, that's a very typical sign for underperforming thyroid. Also dry hair, or if you run your fingers through it and you feel it feels like straw and you can never really get it to look good, this is another indicator that there might be some nutrient deficiencies. Hair loss, of course, is a big one, especially for us women. We freak out if we lose our hair. That can also be related to the thyroid, so make sure that you get this checked. Dry skin in general, cracking or flaky skin, but also itchiness or rashes, all of these things can point towards the thyroid. So did I not promise you it's a long list? But bear with me. We just have to go through a few more, and it's important that you know about this and see that it's so important that we know about our thyroid health and can at least make sure it's not our thyroid if we have any of these symptoms. Moving on to the head area, so if you've been diagnosed with dry eye syndrome, that can be linked to your thyroid as well. Headaches and migraines can be also associated with it. Dry mouth, and not just when you're before a presentation or before a performance, but dry mouth in general, where you always feel like you need to drink something because it's dry. That might be an indication. Ringing in the ear might not always be tinnitus. It can also be indicating towards the thyroid. Puffy face, puffy eyelids, if you have water retention around the head. Hands and legs and things like this. If you have puffy hands, puffy fingers, stiff joints, brittle or peeling nails, or those ridges on your fingernails, that's a very good indication too. If you have tendinitis or carpal tunnel, we see carpal tunnel very often in people with thyroid conditions as well. Another autoimmune condition that often is accompanied by thyroid patients as well is fibromyalgia. So if you have that, or you have problems with your joints, your muscles and your bones, some kind of pain or stiffness, or you have osteoporosis or osteopenia, things like this, stiff muscles in your shoulders and your back, and it's just ongoing and just never seem to go away. All of these things could be behind it as well. Brain is a big one. Our brain fog, hello brain fog, anyone? Memory issues, inability to concentrate, very, very common with thyroid conditions. And of course, again, number one, the weight, the inability to lose weight, or you gain it back very easily. Also, what I always call the muffin top, or belly fat, that can be another indicator because it's also linked to blood sugar regulation, water retention in the body. And last but not least, the immune function is, I don't want to miss out on that one. If you're the person who always has bad head colds, you're getting sick all the time, you have chronic sinus infections, a lot of inflammation in your body at all times, and it takes you much longer to recover, then this is also something you might want to check. The immune system is tightly linked to our thyroid hormones as well. So now I gave you a breakdown of the most common symptoms someone can experience with an imbalanced thyroid. And as you see, it's not just one or two things. It can really be all over depending on your genetic predisposition, where it might show up. So this, I hope, was helpful to you. I hope you took some notes and now inspired to take action to get your thyroid checked. And in my next videos, I will break down which tests you should request from your doctor, what you should be looking into to know if your thyroid struggles. Thanks so much for watching. See you next time. Bye.